Many women wonder when they should have their breasts checked. So in today's video, we are going to talk about breast screening. So Diem, can you explain to us what exactly is breast screening?
So breast screening is actually checking a woman's breast before signs and symptoms of disease have actually occurred. So basically, the assumption is if you do get a breast cancer, you catch it earlier, and therefore you increase the patient's chance of survival.
And so how is screening done?
Actually, screening is done by mammography, and that is the consensus right now. But in some places, you may have access to what we call 3D mammograms.
Okay, and so then when should women be screened?
So the guidelines for an average risk woman actually vary depending on where you live. But generally speaking, women should start screening between the age of 40 and 50, and the screening should be either annually or every second year.
Okay, and so now what about women who are at increased risk of breast cancer?
So if you're known to be at higher risk of getting breast cancer, you should speak to your physician because your screening will be different. Generally speaking, you will have more frequent exams, and sometimes we might use MRI to actually do the screening.
So are mammograms dangerous?
I wouldn't say dangerous because we wouldn't use them, right? But I would say that there are concerns with screening mammogram. The first one is radiation. Now you have to remember that the amount of radiation you get during a mammogram is very small, but if it does lead to repeat films, it adds up. The second thing is false positive. What is a false positive? A false positive is having something picked up by the mammogram that is not really significant. But that being said, it needs to be investigated to make sure it's nothing. And that can lead to anxiety, overdiagnosis, or overtreatment.
Okay, and so I guess one more question I have is about breast self-exam. When should we do these?
Well, I think that's going to be the topic of our next video.